So next is brainstem death. It's V7. I think it's also been discussed somewhere else as well. So let's quickly go through it. A 25-year-old male motorcyclist is admitted under your care to intensive care unit. He arrived in the ED following a road traffic accident with a Glasgow score of 3. A CT scan of his head demonstrated diffuse cerebral edema. The intensivist assessed him after 36 hours and find that he has suffered brainstem death. What is brainstem death? That's irreversible loss of capacity for consciousness and irreversible loss of breathing, which equates with the death of the individual. Why is brainstem death function important to life? The brainstem contains nuclei which controlling the body's major homeostatic mechanisms, including the respiratory centers, cardiovascular centers, arousal centers, and cranial nerves 3 to 12. Loss of nuclei incompatible with the life. What medical criteria needed to be satisfied in order to for a diagnosis of brainstem death to be valid? So there is some pre-requirement that there should be no sedation, no muscle relaxation. Patient must be normothermic. Electrolytes and sugar level should be normal. No decerebrate or decorticate posture. And this brainstem death cannot be performed in a preterm infant less than 37 weeks or infant less than 2 months of age with anencephaly. And anencephalic children, the organ can be procured only after the two transplant clinicians confirm the apnea. Who can diagnose brainstem death? Two medical practitioners who have been registered for more than 5 years can diagnose the brainstem death. One of them should be consultant. Both should be competent in their field, and none of them should be a member of the transplant team. At least one of the doctors should be consultant. 2 sets of tests should be done. The legal term death is at the end of the first set of the test, and confirmatory tests, electroencephalography, cerebral angiography, and transcranial Doppler are not required in UK. So how is brainstem death diagnosed? So I would demonstrate that all brainstem reflexes are absent. So general examination exclude the spontaneous voluntary involuntary movement and show there is no response to stimulation of cranial nerve pathway. Number 1, pupils are fixed and do not respond to the light. They are mediated by the cranial nerve uptake and oculomotor. There is no corneal reflex, trigeminal nerve and 7th cranial nerve as a motor pathway, vestibulo-ocular reflex, and there is no cranial nerve distribution, no motor responses within the cranial nerve distribution like cranial nerve 5 and 7 can be by adequate stimulation of any somatic area, no limb response to the supraorbital pressure, there is no gag reflex or reflex response to the bronchial stimulation with the tracheal suction, sensory 9 and motor 10 cranial nerve, no respiratory movements with when patient is disconnected from the ventilator for 5 minutes following the pre-oxygenation 100% and Meyer systolic pressure more than 90 and partial pressure of carbon dioxide 6 Pascal. The apnea testing has to be abandoned if there are cardiac arrhythmias, but test can be repeated after stabilization of the patient. So what are the prerequisites for the apnea test? Partial pressure of carbon dioxide must be exceed the threshold of the respiratory stimulant, that's more than 6.5 kilopascals, and the partial pressure of carbon dioxide should reach 6.5. This should be ensured by the measurement of the blood gas. The pH should not be kept 7.4. Hypoxia during disconnection should be prevented by delivering oxygen at 6 liters per minute through a catheter in the trachea. Your patient family agree to consider organ donation and ask about the process involved. What is the pathway to organ explantation and retrieval? So pathway to transplantation is the transplant coordinator involved, relatives consulted, brainstem death diagnosed, coroner informed, blood test including serology, virology, and screening test done, donor screen for malignancy, surgical and anesthetic intervention to assess the viability of the organs, and organ retrieval by the dedicated transplant team. When should these cases be referred to the coroner? If the brainstem death is not clearly the result of the natural causes. In England, the coroner, and in the Scotland, the procurator fiscal must be consulted. The transplant coordinator is usually responsible for identifying who is in the lawful possession of the body and for obtaining the necessary authorization of the organ removal. What is the position if the patient carries a donor card? Donor card signed by the patient is binding by the law and overrides any concerns voiced by the relatives. In practice, organs are rarely retrieved against the relatives' wishes. Presumed consent legislation for organ donation came into effect in Wales 2015 and England May 2020. This means people living in Wales and England are considered to not to have any objection to the organ donation. What is the unresponsive wakefulness syndrome? Does it constitute brainstem death? So it's not equivalent to brainstem death, and there is no evidence of higher brain function, but brainstem reflexes are intact. This condition is also known as the persistent vegetative state, PVS, or Apellic syndrome. There is much controversy about its definition and proponent. There are reports of unresponsive wakefulness syndrome being an at least partially reversible. Thank you.